Right. So, good evening, everyone. On the behalf of Team Dentist Channel Online, I would like to extend a very warm welcome to all of you. I'm Dr. Aditi Mishra, and I'll be the host for today's session on the topic myths, decoding the myths and facts about child's oral health, which is a guide for general dental practitioners by Dr. Tanya Batra. So before starting the session, I have few housekeeping notes to make. Those who are joining us from Zoom, and any question you have, you can post your questions in the question and answer box in your control panel, and they'll be taken up one by one at the end of the session. Those who have joined us from Facebook and YouTube, they can also ask us questions by commenting, and they'll be answered at the end of the session. So now let me quickly introduce our speaker with everyone. Dr. Tanya Batra is currently a pediatric dental resident. She had been a resident in Government Hospital New Delhi, and she has been in clinical practice for more than 4 years now. So I welcome Dr. Tanya Batra.
Thank you so much, Aditi.
So over to you, ma'am.
All right. Just a second. I'll just share my screen. Okay. A very good evening to everyone. I welcome you all to the webinar for today, which is decoding the myths and facts about child oral health and to the amazing world of pediatric dentistry. My name is Dr. Tanya Batra. So we know that the world has been changing forever, and the change is the only constant. So this is the picture showing the first pediatric dental setup, which was done in 1956 in Copenhagen. And towards my right is the picture of current pediatric dental practice. So before I go to the myths and the facts of child's oral health, let me know from which profession do you all belong to? Like, do we have general practitioner here or do we have dental students here? You can write it up in your chat box. Okay, so we have general practitioners. Okay, mostly are general practitioners only. Great, great, great. All right. So as general practitioner, I'm sure this question must have been asked to you thousands of times. Like, why is it important to save the primary teeth? I mean, I have loads of patients, lots of parents who come and say that since these are primary teeth, they are going to shed off with time. So why is it important to save the primary teeth for that matter? Well, next time if somebody asks you this question, these are 5 simple ways of answering it. Firstly, you can tell the parent that since if you yourself are having the painful teeth, you're not able to eat. So how do you expect a little child with pain to eat with the painful teeth? Secondly, we all know that at that time when the teeth are growing, the child is he's learning to speak. So there are certain words which can be spoken only with the help of anterior teeth. So if you have cavities or if you have problems in anterior teeth, it definitely leads to problems in speech. Then in this social media dominated world, we all know that how smile is important, how everybody wants to be an Instagram influencer. So how much value the smile holds. Apart from that, there is a basic law that is the primary teeth, they act as natural space maintainer. So definitely they are important for getting this, for guiding the permanent teeth and giving us a natural space maintainer rather than making a fabricated or an artificial one. And to the most important point, which is gaining the confidence of a child. Trust me, I have got patients in which the people or the child is very shy. The parents come and say that my child is very shy, he's not smiling, he's not attending school properly, he's not talking to people. And apart from other reasons, one of the reasons could be that he's having cavitated teeth and he feels really conscious of smiling. So actually, the caries in primary teeth can always lead to low confidence in child, and there are various studies which are supporting this data. Now, apart from the first myth that why primary teeth are important, the second question comes, do we have to treat the young children the same way as we treat as adults? Well, the question is absolutely not. You know, we say that children are miniature adults, but the reality is that you need to take child into as an individual. Like you cannot treat the child, every child the same way. You have to take into consideration that every child have their own thinking, they have their own cognitive abilities. So you need to treat it as per single patient. You cannot treat it as single group. Now, then it comes to the concept of why early dental visits are important. I'm sure when you were in BDS time, you must have heard about the concept of dental home. But in a country like India, I'm not really sure if dental home is being implemented because the actual time when the dental home concept will come is in near future. Currently, there is no dental home formation as such. So when I talk about dental home, what do I mean by that? See, it is very important for us to bring the change. Why is it important? Because every time a parent comes to us, you need to tell them that early childhood visits, early child dental visits are very important. Because if the child comes early, he will have a good attitude towards the dentist. Because till the time a child comes to us as patient, he's around 8 to 9 years of age, and at that time he's very scared of doctors for that matter. Because we all know that in early time, whenever they have gone to a doctor, they must have got vaccinated or they must have got an injection done. So anyhow, the child is always scared of a dentist or a doctor for that matter. So this concept of dental home actually helps us in bringing a good rapport with the patient. Apart from that, this is my sincere request to all the BDS practitioners who are practicing in general practice. Start with the parent when the mother, if you see an expectant mother. See, in private hospitals, there have been a concept of prenatal counseling. So why not we introduce a concept of prenatal oral counseling? Tell them about why oral health is important for them. Tell the mothers, expectant mothers and or mothers of young children about why oral health is important for the babies. And apart from that, how regular dental visits in children will help them out in a longer run rather than waiting a child to get early childhood caries and then coming up and getting himself treated. Apart from that, you can also tell them how saliva transmission can lead to increased caries risk in mothers as well as in children. So apart from that, you need to tell them definitely about the brushing technique. So the question now arises is, every time a parent comes to me, he complains that mera bachcha brush nahi kar raha. But the thing is, the child will not gonna brush on their own. They will imitate the parents. So you have to tell the parents that if the parents are brushing, if they're brushing twice a day, definitely a child will brush twice a day because they are looking on to you. Okay, so it is important for us to teach them that firstly they have to brush twice, and apart from that, they need to do the brushing of their child till the age of at least 6 years of age. Now the question comes, then how do we decide that the child is capable enough of brushing on their own? Well, the data says that if your child is able to tie their own shoelaces, or if they're able to comb their hair or tie their buttons of the shirt, definitely they can brush on their own. So they have built that cognitive ability. But before that, parents need to brush their child's teeth. Now, you all must be knowing this, but I'm just reinforcing it. Which is the correct amount of toothpaste for children? For the age of less than 3 years of age, we say a thin smear or a rice smear. And for the age 3 to 6 years, a pea-size amount of toothpaste is important. Okay. And then there comes a myth that do we use a fluoridated toothpaste or do we use a non-fluoridated toothpaste? Let me tell you, you can use a fluoridated toothpaste even at the age of 3 years. And even if the child has fluorosis, like if you see dental fluorosis, you can use a fluoridated toothpaste. The only thing is the amount of fluoride is not that much that it causes systemic fluoridation in a person who's having a dental fluorosis. So this toothpaste thing will not actually matter when the patient is having fluorosis. Now, how are we planning and how are we protecting ourselves from further problems to come? Well, definitely, if you are actually diagnosing a child only with caries, we are actually missing out with so many other problems. Like we have to look for crowding, we have to look for missing teeth, or we have to look for fractured teeth, because at this time, dental injuries due to sports or trauma is very much common and it's very much prevalent. So as dental practitioners, it is also important for us to actually not just look for traumatic injuries, but to also look for a diet of a child. Because if we do the diet counseling at an early age, we are definitely, helping the child a lot in the longer run. Because not just dental caries, but obesity in children is also very much prevalent. So diet counseling can be done even by a dental professional. Now, coming on to a very important topic, which actually many of the people they tend to miss, which is habits. Now, as a general practitioner, how are we able to diagnose habits? Let me tell you, every second child or every third child, if you look carefully, definitely he will have some kind of habit. I'm not just talking about thumb sucking, I'm talking about basic habits also, like finger biting, nail biting, lip sucking. These are some habits which all the children have. And these also lead to derogatory or malocclusion in the future run. So we need to stop these habits and we need to intervene at the correct time possible. So please look out for habits like thumb sucking, look out for habits like mouth breathing. Ask the parents if the child is he sleeping with the mouth open in the night, or if he's snoring in the night, or you can ask other all questions like if he's sleeping throughout the day, if he's feeling lethargic. There are many symptoms which are associated with mouth breathing. Apart from that, tongue thrusting. Tongue thrusting is a habit which parents will definitely not notice, but as a dentist, we can definitely notice it. So, one interesting concept which I tell every pediatric patient is the concept of tooth fairy. With my patients, I give them little gift whenever I extract a tooth or whenever their tooth naturally shed off. The reason being, the concept of tooth fairy is very old. It's as old as 11th century. And they say that initially it was used by the European civilization. They used to say that rather than a tooth fairy, there's a mice who takes the tooth along. Or there have been other studies which have said different types of people like tooth fairy or tooth person. Someone says there's a magic magician who does that. So there have been various ideology behind the concept of tooth fairy, but it is very much there since long. So definitely, motivate them regarding tooth fairy concept. Give them little gifts. Give them a positive reinforcement, not just in the form of gifts, but in the form of praise also. So all these things actually help you in your clinical practice. Now, this is a very basic thing which we all know and we have studied about, which is sealant. I would actually tell you that if you're using it in your general practice, it's very good. But if you're not, please start using fit and fissure sealants because they're actually helping you in a longer run. If you educate the parents, if you tell them about the importance of sealants, they'll definitely get it done for their children. Apart from that, fluoride treatment, they say that if a child is having a higher caries index, by high caries index, I mean if they're having more than 2 cavities in the oral cavity, definitely you have to go for fluoride treatment every 3 months. The American Academy of Pediatric Dentistry says that if a child is having high caries index, definitely fluoride treatment for every 3 months. If he is having a low caries index, fluoride treatment is still indicated every 6 months. So yes, you need to follow this protocol in your general practice as well. Now, another thing which has been stated in the textbook, but many of the people, even in my consultations also, have seen that many people do not reinforce this habit of space maintainers. Every time you get a tooth, primary tooth, if you're extracting it, and if you can see that permanent teeth has time to come up, definitely go for space maintainers because in the longer run, we are actually saving the loss. Like, it's very easy to say that the child can go for orthodontic treatment afterwards. But if we can, save ourselves from that kind of damage, we are definitely doing something good. So space maintainers have to be, and it's an absolute indication in case if you see that there is premature loss of tooth. Now, coming to the concept of nursing bottle caries and how do you guide the mothers for that? Firstly, as I said, fluoride and all is important, but before that, the very important thing is to guide the mothers or the parents about bottle feeding. Like, many patients, they come and they say that my child has this habit of feeding at night and they're feeding with sugar. So what kind of counseling we as dentists can provide? Firstly, we can tell them that if you really want your child to feed, either do not put sugar in the milk. And secondly, if you're doing the night feeding, take a wet gauze and clean the tooth before actually putting the child to sleep. make it a habit that apart from brushing, if the child is very small, we need to clean the oral cavity before. Now, a very popular concept, which is sedation dentistry. So basically, conscious sedation, I've also been using in my hospital practice. But one thing which I would like to tell you all, it's not a magic. It's just a technique. Yes, it has wonderful results. Yes, I've seen wonderful results with it. But one thing which everybody should know, if you're making a child very uncooperative in the beginning, and then you're expecting the child that he will, get the treatment done under sedation, it doesn't happen like that. For that, we have general anesthesia option. In case of sedation, like nitrous oxide inhalation sedation, it is useful if it is your child's first visit or the child is cooperative or potentially cooperative or mildly uncooperative. But in proper uncooperative child, you cannot use sedation dentistry. So it's better that we desensitize the child before and then opt for sedation dentistry or nitrous oxide inhalation sedation. Now, coming on to the concept of lasers in dentistry, even in pediatric dentistry, we are using lasers. Lasers are basically used for crown exposures. They're used for many things. We are even using it for fluoride activation. Such basic procedures are done with lasers also, like disinfecting cavity, using it for fluoride activation, using it for frenectomy, and child accepts it beautifully. Even children are more comfortable with laser rather than using a blade or using a scalpel. Now, a very important question which many people ask is, when do we have to give a permanent crown, and when do we decide that we can give a permanent crown in a young permanent tooth? Well, PFM crowns or zirconia crowns in permanent tooth cannot be given till the time the second molar erupts. This is what the literature states. Apart from that, they say that active eruption of gingiva takes place for a particular time. So there is no age consideration as such, but one thing we have to make sure that the second molar has erupted in the oral cavity before we plan for permanent tooth. But till that time, we can definitely give stainless steel crown. And in primary teeth, today in current scenario, we have options of zirconia crowns as well in primary teeth. So the next question talk is about when to start the orthodontic treatment. I'm sure many of us in clinical practice have seen this kind of scenario when the parent come, and even we believe that till the time canines are up, we should not do the orthodontic treatment. This is a myth. This should not be done. Actually, we can start the orthodontic treatment, like minor orthodontic corrections can be done as early as at the age of 7 years, 8 years. We can do crossbite correction. We can do minor flaring correction. But the only consideration which we see when the canines erupt is the Broadbent phenomena. That is, if the canines are erupting and if you are seeing the flaring of the incisors, that is the time that we have to wait for the orthodontic treatment. Apart from that, minor corrections, minor crowding, crossbite correction, and even habit correction can be done at early intervention. This is as early as possible, not waiting for the child to grow 14 years of age, occlusion development, and then start for orthodontic. Till that time, the damage is already been done. Now, coming on to a very important topic like the elephant in the room, which is the third wave. Actually, everybody is saying that special attention has to be given in children during the third wave. So, pediatric dentistry also, I would say that since children are the future, we need to take extra precautions and we need to tell the parents to get vaccinated, because anyhow, the vaccine for children is soon or is yet to come. So, if parents are vaccinated, the transmission to child is very less. So, definitely, you need to counsel the parents on COVID, its precautions, and vaccinations as well. So this sums up the webinar for today. You can write to me all the questions. You can mail it to me as well. And even right now also, you can ask me if you have any query. Thank you.
Thank you so much, Doctor, for busting all our myths that we had. And now I request all the participants to kindly ask their questions in the question and answer box so that we can take up each and every question and Doctor will be answering them. Meanwhile, Doctor, I will just seek your permission to share one PPT with all the participants before taking up the question and answer session.
Definitely.
All right. So All right. So this is our company, DentistChannel.Online, with the motto "Healthy smiles leads to wealthy lives." So I request all the participants to kindly save this number for the latest updates. If you need any kind of updates from our website, like whatever webinars we are having, whatever workshops we are having in future, you'll be getting latest updates from this number. So I request you to kindly save this number and send one message containing your name to this number, and you'll be added to our broadcast list. Now I'll be quickly going through the upcoming webinars that we are having. Sorry for little technical glitch that I'm having. Okay, so on 18th of August, that is Wednesday, we are having this webinar on aging the healthier way. I request all the participants to kindly invite their parents as well to the webinar, because she is a physiotherapist, Dr. Milani, and she'll be telling you how it is important and how much it is important to take care of your health while growing up. So this is our webinar. Next, we'll be having on NEET MBS counseling, a detailed review by Dr. Sunny Mavi. Trust me, he's the best person to speak on this topic. And since we are having NEET counseling from 20th of August, so this webinar you shouldn't miss at all. Next, we'll be having one webinar on mantras for successful dental practice. I know during this COVID scenario, almost everyone is facing something or the other, in the practice. So you should attend this webinar by Dr. Major Prashant Kumar Singh Chauhan on 29th of August 2021, Sunday, 5 p.m. If you have any doubts regarding any webinar or workshop, you can contact on this number, and or you can visit our website events.dentistchannel.online. You can follow us on Facebook, Instagram, YouTube, and Twitter. And those who have not subscribed us on our membership list, kindly subscribe us so that you will get notified whenever we are having any webinars.
Okay, so I think Dr. Aditi is having certain issues on network, so she'll be joining us soon. Anybody is having any question regarding the webinar? You guys are free to ask. Okay, anyways, if you people have any questions, you definitely, I've given you my email ID. You can ping me anytime. And thank you so much for your patient listening. And we hope that you attend the other webinars as well. Thank you.